Hi, this is Cynthia Jester with United States University FMP program, and this is HEENT video. I will start the room scan. Okay, you gotta come close. Okay, I have washed my hands and I'm here with my patient, and I'm going to ask her if she will consent to this video being uploaded to YouTube for educational purposes for a grade for my class. Do you give your consent to upload this video to YouTube?
Yes, I do.
All right. Okay, thank you, and the exam will begin. And I will start by inspecting the head. I'm looking at the shape of the head. I'm looking for any deformities. I'm looking for any injuries, any lesions, and I don't see any. Okay, I'm going to palpate the scalp for any indentations, for any trauma, any deformity. Okay, there is no no deformities, there is no indentations, and there are no lesions to the scalp, and the hair is clean, it's full, it's soft, and there are no bald spots. I'm going to start by inspecting the eyes. So the eyes are normal placement, mid-center in the face, and there are the lacrimal ducts are not swollen. There's no excessive tearing. There's no potus or exothymos of the eyes. The lids and the eyelashes are clean. They're without any erosion or any type of sores or anything. There's no jaundice in the eyes. The conjunctiva is pink. The sclera is white. The pupils are round. Both of them are equal in size and color. Okay, so I will start with the eye chart. And if we were in the doctor's office, the chart would be on the wall and it would be 20 feet. But we are here in a small confines, so we are six feet apart for the purpose of the video. And so I'm going to ask you to cover your left eye and read with your right eye.
FPH.
Okay, and that is correct. So let's do the other eye. Cover right eye. Okay, read your best line.
FPH.
Okay, and my client, her vision is 20/20, and I am going to assess her the 6 cardinal fields of vision for cranial nerve 3, 4, and 6. All right, if you will just follow, I need you to cover one eye. Okay, cover the right eye. Okay. Follow only with your eyes. Okay. Okay. Okay, she was successful at doing that. Cover your opposite eye, and we're going to do the same thing. Okay, very good. Now I am going to check her peripheral vision. If you could cover your left eye and let me know when you can see my fingers.
I see them. I see them. I see them.
Okay, cover your opposite eye.
I see. I see them. I see them.
Okay, so she's got 180 degrees with her peripheral vision, and she's 20/20 on the Snellen chart. So I will also check for accommodation, and I will ask my client, okay, focus right here on this ophthalmoscope. Okay, now look far, like to the refrigerator. Okay, all right, and her pupils were able to dilate and constrict. With near vision, they are constricted. With the far vision, they were dilated. So she has the ability to accommodate with the with her eyes. Okay, and the next one I'm going to do is to see if her eyes will converge. So I'm going to take my finger and I'm going to move it in towards the face and to see which direction the eyes will come down. Okay, and so her eyes were able to converge to the center of her eyes, and so that was it for that. Okay, so now I'm going to do direct and consensual accommodation of the eyes. Okay, for safety, I'm going to do right eye to right eye, left eye to left eye. And I'm going to brace my patient so that if anything was to happen, that I wouldn't bump into her, to keep my distance. Okay. All right. Okay. She has constriction. Okay, she's got constriction. And now I'm going to look at to see if when I shine a light in one eye, to see if it accommodates in the next eye, if it also has constriction. Okay. Okay. All right. Okay, yes. So she has constriction and she has accommodation. Let me see. The next thing I would like to do is I would like to look at the eye structures. So I'm going to hold, that's when I'm going to hold my my ophthalmoscope, and then I'm going to go from right eye to right eye, left eye to left eye, to avoid any injuries for the eye exam. And I'm going to brace my patient. Okay, I'm going to come in and I'm looking at the eye structures. I'm coming over, I'm looking at the blood vessels. There's no cotton wool, there's no AV nicking. I see the red reflex. I see the macula. And the cup to disc is 1 to 3. I'm going to check the opposite. And it's left eye to left eye, and brace the patient. Okay, I'm coming in for the red reflex, and I see the blood vessels. There's no cotton wall nicking. The cup to disc is sharp. It's 1 to 3, and I see the red reflex. And all of the structures of the eye are normal. There's no disease in her eyes. So I'm gonna change Okay, I'm gonna have you to hold one nostril. Okay, take a deep breath in. Okay, hold the other one. Let this one go. Okay. Okay, if she can breathe so the nostrils are patent. So I have a smell test. Okay. Close one nose. Okay, tell me what you smell.
Oranges.
Okay, and that is correct. Okay, cover the other one. Tell me, what do you smell?
Grapes.
Okay, all right, so that is correct. I'm gonna look at the nose structures, the turbines. Looking for any lesions, any drainage, any redness or swelling. Okay. All right, I can see the turbines. They are nice, moist pink. There's no lesions, there's no nodules, there's no drainage, there's no edema. And the opposite, for right and left, I see the nasal turbines. They're nice and pink. They're moist. There's no nodules. There's no drainage. There's no edema or any signs of infection with the nasals. I'm going to palpate the sinuses. Okay, any pain in the frontals?
No.
Any pain in the facial?
No.
So the maxillary sinus and the frontal sinuses, there are no pain. And I'm going to inspect the mouth. Okay, open up wide. Okay. All right, and the tongue is nice and pink. The papillae are 1 centimeter. The inside of the jaws, the buccal is nice, pink, moist. There's no hyperplasia of the gums. The palate is intact, no lesions, no redness, no swelling. Tonsils are +1. There's no drainage. The pharynx is nice, pink, moist. There's no drainage. There's no redness. There's no swelling. There's no edema. There is no cavities in the mouth. The teeth are normal. Go under like your tongue. Okay. And the salivatory glands are nice, moist, pink. There's no nodules, no redness, no swelling. I need you to say okay, and her uvula, it raises as it should with the cranial nerve. And okay, you can close your mouth. All right, and the lips are nice and moist and smooth. There's no sores, there's no lesions, there's no erosions or anything. Okay, so I'm going to palpate the cervical lymph nodes, and I'm going to go pre-auricular, post-auricular, post-cervical, anterior cervical, submental, submanual, supraclavicular lymph nodes, and they are soft. There are no hard nodules. There's no swelling. There's no matting of the nodules. Okay, and I'm going to do range of motion on your neck. I need you to move your neck from side to side, hyperextended, around and around. Okay, any pain or discomfort with that? Okay, and I'm going to ask you to turn your face against pressure. Okay, good strength. All right, turn for the other side. All right, her strength, sternomastoid strength would be 5/5. I'm going to test her shoulder shrug. Put your shoulders up. leave it up, it'll go push down. Okay, she's got 5/5 strength in the sternal accessory muscles. She's got good upper body strength. I am going to palpate the, I'm going to inspect the tracheal area, the tangential view from the side. There is no goiter, there is no swelling, there is no edema. And let me see. Okay. Okay. And anterior cervical nodes that line deep along the thyroid and the anterior of the chest. I'm going to examine the thyroid. I'm going to put my fingers at about the second ring of the cartilage above the isthmus, right around the isthmus, down below the submental, up above the cervical notch. Okay. All right, and I don't feel any swollen or nodules, no edema. There's no pain there. And I'm gonna have her to swallow first to visualize the thyroid. Okay, swallow. Okay, I don't see the thyroid protruding or anything. The thyroid is within its natural position. And then I will come to the back and I will examine the thyroid and have the patient swallow. Okay, so once again, I'm about at the second ring in the cartilage and I'm palpating. I need her to swallow. Okay, she's swallowing. Okay, and I can feel the tissue move up and down. It's nice and smooth. There's no nodules. There's no pain. No nodules, no pain, no swelling, and no redness. I need to look at the cornea and the iris of the eye. Okay. All right, the cornea, there is no injury. The iris, it reacts. It is a muscle. It opens and it closes for the right and the left. I think I have covered everything. Oh, no, I have to do the ears. Okay. Okay, so I'm going to examine the ear, the external structures. I'm going to pull on the auricle. I'm going to pull down on the tragus. I'm going to look inside the ear. And there is no edema, there's no drainage, there's no lesions. I'm looking at the tympanic membrane and it is pearly gray. I can see the malleus and I can see the umba structures. And there is no injury to the ears. I will come over and I will do the opposite ear. Okay. And for safety, I'm bracing the patient and holding the ophthalmoscope so that I have full control and the patient is not injured if I happen to go forward or somebody bump me. Okay, I'm gonna pull on the tragus and auricle. Is there any pain?
No.
There's no pain. Looking in the ear, the canal is free of any cerumen, as well as the other ear. There is no cerumen present. I'm looking at the tympanic membrane. It is pearly gray. I'm looking at the malleus and the staple. There is no drainage, no redness, no swelling in either one of the ears. And I'm going to do the whisper test. Okay. Just saying anything. Okay, all right. Okay, so I'm going to whisper a word to my patient, and then she has to repeat it. So this is the whisper test. 99.
99.
Okay. 21.
21.
Okay, wait a minute. Cover one ear. Cover one ear. Okay. 99.
99.
Okay, now cover the other ear. 21.
21.
Okay, all right. So her hearing is intact, and I'm going to use the tuning fork. I'm going to do the Weber and the Ryan test. I'm going to place the tuning fork on my patient's head and tell me, where do you hear it? Both ears.
Both ears.
Okay, so she hears it in both ears. Okay, all right, and then I'm going to, both ears equal?
Yes.
Okay. Now I'm going to put this on the back of the manual bone and tell me when you stop hearing it.
I stopped hearing it.
Okay, and then I'll put it to your ear. Can you still hear it?
Yes.
Okay, let me know when you stop hearing it.
I stopped hearing it.
Okay, so bone conduction is greater than air conduction in the right ear. Okay, and I'm going to do the same here. Strike it. I'm putting it on the back of the mandibular bone. You stop hearing
Yeah, I stopped hearing
it?
it.
Okay, and now
I hear it.
let me know when you stop hearing it.
I stopped hearing it.
Okay, all right. So air conduction is greater than bone conduction. Okay, thank you for HEENT.